It should be noted that to make any suggestions to a sleeping subject which would be resented by him if he were fully conscious will bring into operation a resistance, and not only will the suggestion be ineffective, but the subject will in all probability wake up. This method would obviously not be used without the prior consent of the individual concerned, excepting of course under unusual circumstances such as parents possessing some psychological knowledge and wishing to cure a child of some bad habit, such as bedwetting. Do not begin to operate this method until the subject has been soundly asleep for at least an hour and a half. If the subject is not used to you being in the room whilst he is asleep, it is better if the induction is spaced over a period of a week or more. For the first approach, content yourself by merely entering the room and sitting 15 minutes or so at some distance from the bed in which the subject is sleeping. Do absolutely nothing. Content yourself for the first few sessions by carrying out the same procedure, but each time approaching nearer to where the subject is sleeping. If the approach you are making is slow and gradual, in a short time you should be able to sit on the bed of the sleeper without in any way disturbing him. When the subject is not roused from his sleep condition by your presence, you can finally address him in a quiet, low voice or touch him without awakening. The purpose of this slow approach is to accustom him to the slight sounds you will make by breathing and moving, and so your presence does not disturb him. Under ordinary circumstances, any unfamiliar sound or smell, such as a smell of fire or a stranger entering the bedroom, will arouse the individual immediately. When the point is arrived at, in which the individual can be addressed in a quiet, low voice, the required suggestion can be put that he is going to do as you suggest, that he will be more confident, and is going to lose any bad habits. This method is especially suitable for a mother or a nurse to use with children. There are a wide variety of methods which employ the sense of hearing. The basis of this method is monotony. This monotonous stimulation aided by suggestion often succeeds where other methods fail. The tick of a clock or a metronome may be used. It is preferable that the tick should be slow. Suggestions may be employed at the same time so that the hypnotist's spoken suggestions and the ticks are both being heard simultaneously. Another method is to instruct the subject to imagine that the ticks are words, saying, for example, you are going to sleep. You are going to sleep. So that they form a regular pattern. Sometimes a hypnotist may be seen to carry out a very rapid hypnotic induction. The induction may take place in 1 second, appearing to be instantaneous, and to the uninitiated seemingly bordering on magic. These ultra-rapid inductions may be brought about in 2 separate ways. In the first way, the subject has been previously hypnotized, and a post-hypnotic suggestion has been made to him that he will instantly pass into a hypnotic trance again at a given cue from the hypnotist. For example, the hypnotist may, when the subject is hypnotized, tell him, "In a few moments I am going to wake you, and afterwards, if I say the word sleep to you, you will immediately go into a hypnotic trance." If the hypnotist, after waking the subject, approaches him and says sleep, the subject will immediately pass into a trance. The hypnotic induction takes place instantaneously and is very spectacular, but in actual fact the same effect could be produced with the same subject simply by saying to him, "When I snap my fingers, you will go fast asleep." If this were done, he would go into a trance just as rapidly. The whole secret of this is to choose a good hypnotic subject who has previously been hypnotized and who, in consequence of this, will pass again into a trance very quickly. In addition to the above method, a very rapid induction can be carried out on certain people who have never been previously hypnotized. These are certain types of person who were described by Bennett as spontaneous somnambulists. The triggering off of the trance is dependent on the skill and technique of the hypnotist. While in this course I have advocated only conservative methods of hypnotic induction, I am for record purposes giving the following description of this method of hypnotic induction on the lines which it used to be performed by stage hypnotists when they gave public demonstrations of hypnotism for entertainment. Quite rightly, these demonstrations were banned by an act of parliament. The hypnotist usually had his subject, perhaps victim would be a better word, close his eyes and stand stiffly to attention. Then, making a sudden noise, either by shouting or clapping his hands together, he swayed him rapidly backwards and laid him flat on the ground. The shock of the sudden noise, the closing of the eyes, the sudden movement backwards, plus the hypnotist's suggestions, all aided in disorientating the subject. From the point of view of a showman, this type of induction was impressive, but it was not only a breach of good taste, but also a betrayal of the confidence placed in the hypnotist by the unsuspecting volunteer. A number of different drugs are used to produce changes in states of consciousness. Some of these states resemble hypnosis, but none are identical with hypnosis, produced by the methods explained in this course. The administration of most drugs necessitates medical knowledge, and trance induction by these means does not come within the scope of this work. It is reported that hypnosis can be produced by pressure on certain nerves, veins, and arteries. There is no doubt that this is so, but it is doubtful whether the hypnotic state is attained as a direct result of these physical manipulations, however an intermediate submissive state is produced, from which the transition to the hypnotic trance is affected by forceful suggestions. These physical means will be known to some physicians, but in view of the attendant hazards of such methods, it is better they are disregarded. They are reported here simply to record them and to advise any students of the subject who may have heard of them not to be so ill-advised as to attempt to experiment with them. There are also some mechanical devices which are used as a means of inducing hypnosis. Among these are revolving discs, mirrors, artificial eyes, and photographs of a hypnotist's eyes. But all of these visual methods have the very serious disadvantage of ceasing to be operative at the most vital and critical point in the induction, which is, of course, when the subject closed his eyes. There is no doubt that the soundest method of hypnotizing a subject is a hypnotic induction. One of the author's hypnotic inductions on record and on a tape recording is in regular use as a hypnotic conditioning method by many students of hypnosis and self-hypnosis.